something that concerning health, and that is sexually transmitted diseases, and why they are too much among the youth. And scientists say that actually women have a higher chance of contracting STDs.
But that doesn't mean men are safe.
We are very privileged to be joined by officials from Straight Talk, the magazine. Thank you so much for joining us, and I'll be shedding some light on that. I'll start by asking you something. But for you, what is an STD? When someone tells you STD, what comes to your mind?
It's basically sexually transmitted disease, meaning a woman who is sick infecting a man who is normal.
Or a man who is sick.
Or a man who is sick infecting a woman who is what?
Who is normal.
Who is normal.
Right.
Okay? That is mainly gonorrhea, AIDS, and what have you. The syphilis.
Okay. You've mentioned gonorrhea and HIV. What STD do you know?
To the moment, those are the major diseases we know. A man uniting with a woman so that you get an infected disease. So in general, what we know in common is AIDS, syphilis, and this other when you united, both of you.
They are just saying that a man meeting with a woman, but still like AIDS, even if you have not tried sex, if you are to get affected, as long as you use maybe bad utensils, either a razor blade, which has cutted somebody, and you touch on somebody, that person who is already affected, it will get you, in case you have a wound. So it's not purposely that you get affected when you play sex with a different.
Yes. You might be asking what are STDs, and some of these things we'll have studied them in school. And I'll ask the gentleman from Straight Talk. What are the most common STDs in Uganda?
In Uganda, when you talk about STDs, most people refer to gonorrhea and syphilis. But also I must say that there is very little knowledge when you talk about sexually transmitted diseases. In one of the schools I visited when I just started working, a head teacher sent away all the kids to go back to their homes, and he thought there was an outbreak of syphilis. That is just an indication how ignorant Ugandans are about sexually transmitted diseases. So it's important that we know that sexually transmitted diseases are majorly transmitted through having unprotected sex with an infected person. Usually people refer to, what about hygiene? What about those things? What about if I squat on a toilet? In fact, many people fear to use public toilets. There could be very, very few cases where people can get sexually transmitted diseases as a result of poor hygiene, but over 80% of the sexually transmitted diseases we see are transmitted or spread through having unprotected sexual intercourse with an infected person.
What about these high levels of candida in women?
A few issues. Candida, of course, in women, there are a few issues of hygiene, issues of immunity. But I must say that the main majority of the sexually transmitted diseases we see are a result of people having sex, and they're having sex and it's not protected. I must say that the challenge with STDs is that when we get these STDs, sometimes the symptoms or the signs, they don't manifest very quickly. So you could be there 3 weeks, you are there with an STD, maybe a gonorrhea or chlamydia or syphilis, and you never get to know about it. 3 weeks or 4 weeks down the road, then you are beginning to scratch around the genitals, you see sores, and then what comes to the people's mind, then they are starting to connect, who gave it to me? And then they start to fear to go to maybe a health specialist or a clinic, and things just continue like that. And for the young people, they just don't even care, many of them. They get these STDs and they keep having sex with their fellow young people, and they spread the diseases like the news has been coming out.
Tell me about genital, is it genital herpes?
Genital herpes, these are like sores. People mistake them like pimples. So because we are shy, the majority fear to express what is happening to them, and it develops into a serious issue.
So how do you tell the difference between having a normal pimple after shaving and having herpes?
herpes, it will go on, and because a pimple may go away after sometimes if you treat it. So because you can't differentiate, because you are not a medic, you cannot say that this is not a pimple, this is a herpes. You're just supposed to go, whatever happens to you that is abnormal to your health, you should go to the hospital and you get expressed to the clinician and they get away out.
Sometimes it's quite discomforting to just go and tell the doctor.
And then they come for
Things are-
lie down and spread your...
There is a terrible. We'll be looking at that later, but we got an opportunity to speak to Belinda Tumushabe, who is a health specialist at Maxon Bay Hospital, Uzira. Let's take a look at what she has to say. When we come back, we'll be looking at why STDs are spreading fast among the youth. Take a look.
Sexually transmitted diseases are diseases that are contracted through sexual intercourse and of course are transmitted through fluids, body fluids. We have most at-risk populations to sexually transmitted infections. Of course, teenagers, the youth, you know that is the area that is that they are active, you know, their hormones are high, so they have a lot of sex. The others are women. Of course, the children can transmit it from their mothers. We have different modes of transmission. They could acquire it from the mothers. We know that some of these can be transmitted secondary. The primary is sexual, but we have the secondary transmission through sharing things like towels and undergarments. So if we could avoid that, it would be good. We have a number of them which could be broken down into the bacterial, which are like syphilis. We have fungi, which are like candidiasis. We have viruses like HIV and hepatitis B. We have even those of direct contact, the parasites and protozoa like lice and scabies and so many others. But the most prevalent are HIV, gonorrhea and syphilis, and they are causing a lot of harm. We have vaccination for some of these, especially the viruses, and for cancers. If they can access vaccination for these diseases, it would also be good for them. I would like to say that the youth should not shy away from the fact that these diseases actually take place and they happen and they are exposed to them. They shouldn't run away from them. They should run to a medical worker, get attention, proper medication. They shouldn't buy Panadol and Fragile at a different health facility. They should make sure they see an expert who can treat them. I would also talk to the parents. I hope some of the parents would be able to get this. Let us try to talk to our children.
Two things, and I'll come to the parents later, but you work with young people.
Yes.
What are some of the things, the reasons you've discovered?
Why the cities are spreading? You know that our health facilities in Uganda are really crowded. If you look at our patient health specialist or doctor ratio, it's really high. You can imagine when the young people get the STDs, they're imagining I'm going to this health facility and my uncle is there, my mother is there, my father must be there.
My
And when
girlfriend.
my girlfriend, and they see me in a line, what is going to be their first response? Oh, in fact, when the young people are in the queue, if they see their relative, they're going to come up with something like, I have a headache, or something like that. So part of the barrier has to do with the way our health facilities are arranged. They're not friendly to the young people.
For you, why do you think STDs are spreading quickly among the young people?
The young people expect much from the parents, but the parents also expect much from the schools. So no one is giving the information that is required.
Right.
And the people who have information, it is limited. They don't have all the information required, like my colleague said.
Right.
Yes, so that is why the youth today are doing things that they are doing. Not because they want, but because they are lacking information from the parents and from the schools.
Right. When you are growing up, did you expect your parents to talk to you about sexuality?
Wow, somewhere it was a little forbidden that a parent here talks to you. Okay, this basically is like in everyone's village. Okay, basically parents look at that as a taboo. Not until a kid grows up that he goes to hear the aunties, the so-called. But now recently, now we have the so-called senga muumuza senga because of it. but they are addressing other issues. They are leaving out these other issues.
The important ones.
The important ones, say addressing STDs. For them, what they are all about, that I analyze the bounds.
Sexual position.
They should also incorporate some of these things.
Yes.
Okay? Because now it's like, today, they are the singers that we know. Basically, there's a big gap, surely.
That's true.
If we look at another side of a coin, we parents, sincerely speaking, some of our children also are too stubborn that you cannot add too sharp that you cannot bring an advice to him or her, and he agrees. One may say, Mzee, now you are just against me, what? So some of the parents fear at least to give advice to their children simply because their kids are sharper than them.
People have tended to be ignorant that the young people are safe. When these men break out of their marriages, they go for the young kids, the youths. They think they are safe instead of
fresh blood
testing them. So when I'm engaged with anyone, because he did test me, I'll be shy to say out that I was engaged with someone. So if my age mate comes to me, I will just go in and he may not mind because he knows I'm young. He will say that maybe I'm safe. So ignorance has also increased the rate of the spread of the STDs.
That's very good. Some information. A report that was released says at least 2% of Ugandan adults have syphilis. That's about 300,000 Ugandans have syphilis. The report says 7.3% of Ugandan adults are living with HIV, and it has increased to 6.4% in the past year. The report also says 36% of women and 18% of men who had ever had sex said they had an STD in the year, that particular year.
One of the reasons why we are seeing many cases of sexually transmitted diseases, and your reference to syphilis, we don't also have a culture in our country of completing treatment. Many of the people that go to the health facilities, once they're given the medication, they're feeling better, the signs and symptoms have disappeared. That's it. And some of the STDs would require a long-term treatment. Okay? But also the whole habit of going and for checkups once you engage in risky sex does not exist.
Right.
So coming back to the issue of low condom use, that is there. But also the statistics are showing that there's a very high met need for family planning, including condom use.
Right.
So lots of people access the condoms, but many of them do not actually use them.
There was a camp in Chireka, and out of the 60 patients that they were looking at, 40 had gonorrhea and 20 had syphilis. Now, of course, this shocked American doctors that were taking care of the girls, because one, it's very expensive to treat here, because in the US when you get an STD you're treated for free, because it's believed that these kind of diseases contract easily, and they don't want the whole population to get it. So they come, you get, and get treatment right away at no cost. In Uganda, of course, you have to pay at least 50,000 shillings. Now, I want us to commit ourselves. I'll start with parents. What are you going to do?
No advising abana baffe n'abantu abalala okulaba nti endwadde ezo tezeeyongerayo. Oba olina omwana wo obanga ali from 15 oba 12, beera ng'omubuulirira kiki ekigenda mu maaso about sexual transmitted diseases.
Sexuality education should be given in an age-appropriate manner. The messages should be age-appropriate. Just like as you start with your 2-year-old and you talk to them about sitting properly. That's sex education. As they go to 3 years, do not have bad touches. That's a good message, and that's what actually we try to do in Straight Talk. As they go in P7, and they start developing feelings, telling them feelings are normal, but you shouldn't engage. So as they keep growing, we need to be able to give messages that are age appropriate.
Yes.
When kids usually go to secondary school, some of them start engaging in sex, but the parents are still saying, abstain and don't have sex. And actually, that's why the kids, some of them just look at and
Because I
laugh.
think when we were growing up, signing true love waits. To signing
we like to wait.
So the fear of death made us protect ourselves, I guess. But if you're at home and you're seated with your kids right now watching this show, what kind of conversation would you have with your child? Condom. Njagala kubuuza the men before we close this chapter. Men, we have been accused of course, the low condom use. Why is it hard for men to buy condoms at shops? You reach there, you start asking for biscuits. Please give me a Coca-Cola. You take the whole crate.
You know, remember the places whereby the activity is going to take place. Those are the shops where it's basically within your area. In that there are instances whereby maybe a man, the shopkeeper will say, "Hey, now this guy goes for these rounds." You see, there's that kind of thing. Okay, but like I want to tell you of a story. What happens in my area where I stay, or nearby on my way home. There is a lady, she has a shop, okay? But besides her shop, somewhere they put their box, so suggestion box, condoms are for free. But I can assure I've monitored that place, okay? For the time I've been around, and the rate of use of condom, okay? It is so high, in that by the time I pass there, they are they've removed
You go
the
to
condom.
check and there's
In
nothing.
other words, so this one gives you the information that people fear to go to the shops. But these condoms are given for free. They are put there in that it gives me an impression that people pass there at night and pick. Okay? So what does this tell us? It tells us that for the policy people, they should go ahead and set up and basically revisit their policies to address this issue.
Right.
Basically bridging the information gap.
Right. I think right now what bar owners now put them in their toilets. You can get it. You can get condoms for free. But ultimately, we are looking at protecting the next generation of leaders, of people in this country.